In providing great service, everyone must contribute to what the office does. So it means that first, it's a choice. We make a choice that we're going to give great service. Everybody has to buy into that. They have to be committed to it. They have to be accountable for it. We begin with the vision. We embrace the vision. We think outside the box. Remember that it has to come from the heart. And this is an area where I find difficulty in a lot of offices of really getting emotionally involved in what you do and putting your heart and soul into it and making a connection to the needs of the patients and what they're really looking for from us. And it requires some effort. And we have a brief little video that shows how just about anybody in a situation can make a difference. So who's going to be Johnny in your office? Everybody going to think of things that you can do that are, what are some of the things that you can do that are special in line with what Johnny did there? Maybe giving recipes out. Maybe it's helping an elderly person from their car. Maybe it's walking somebody to their car holding an umbrella over their head. I'll give an example that went by in my office, and that is a few years ago we had an elderly patient scheduled for an 8-unit bridge on a morning when they were predicting a heavy snowstorm. The snowstorm came during the night, and the patient was usually brought to the office by a woman who was even 5 years older than she was. So there was no way that they were going to come to the office, but I have a truck. And so I called up Mrs. D and I said, how would you like me to pick you up in the morning and bring you to the office? And we'll all have breakfast together, and then we can do the work, and I'll take you home afterwards. How does that sound? And she was very excited because she really wanted to get this work done. She was uncomfortable. So we spent about 5 hours in the office doing what was necessary for her. And I took her home a little afternoon, and when I got into her house, I noticed that nobody had shoveled her walk. And there was quite a bit of snow there. And so I told her to wait in the car. I took the shovel out of the back, and I shoveled a very narrow path to her front steps, and I walked her to the front steps. And then I said, give me just a few minutes. I wanted to make the path a little bit wider for her. So while I was shoveling out there, and she's standing on the front steps of her house, you know how it is when there's a big snowstorm, everybody's out in the street shoveling their walk, and it's like a block party. But while I'm shoveling her walk, she's shouting to everybody on her block, this is my dentist. And don't you know that within the next few weeks, we had a couple of her neighbors come to the station. And we tell this story to some people, and inevitably there's a doctor somewhere in the audience or a team member that says it sounds corny, it sounds kind of lame, pushy, but it's not if that's the type of culture you have created, where people know you will do anything for them in any capacity to make them comfortable, to make them feel special, to make it feel like it's an environment that they want to be a part of, and that they would want to send the people that they love, the people that they know that they're friends with, to come to you with the same type of care. So it's just looking for the little extra things that you can do, like Johnny, the bagger. You know, I don't ever want to hear somebody say, well, I'm only the dental assistant. What do you mean only the dental? You are especially the dental assistant. And there's nobody who provides better care for our patients than the assistant. They are the lifeblood of the offices. They're the people that our patients talk to and put their confidence in, more than the doctors. And so the doctors really have to realize that. And those of you who are clinical assistants need to realize that as well. You do a very difficult job, and I respect what you do immensely. And there aren't many people who can do what you do as well as you do it under the situations and the conditions that you do it in a very difficult environment, in a closed space, close to other people. It's a very stressful environment, and you do it each and every day, hopefully with a smile on your face because of a positive culture as well. So think about who's going to be Johnny in your office on Monday morning, and what each of you are going to do to create a positive, special environment for your patients.